Panel discussion, nurturing great leaders from early seeds, unleashing potential in the early years. Round of applause for Katarina Mahadeva Cadwell, MD. Okay, and Hiba I got it? Okay, MPH. Please join our panel with a round of applause.
Well, good afternoon. Welcome everyone to today's panel discussion with this fantastic topic of nurturing great leaders from early seeds and unleashing potential in the early years. And I just want to say that I was really impressed with the discussions that we already had, the fireside chats that went before us here today. They actually brought up a lot of points where I kept thinking, oh my God, I can talk so much about that too, but I need to tone it down and not get overly excited, because some of that will lead into what we will be discussing, especially when we brought up things of health equity, cultural understanding, and empathy, actually. So I'm Dr. Katarina Mahadeva-Cadwell, internist and palliative care specialist with 20 years in clinical practice. I'm also an integrative nutrition health coach and a Stanford LEAD graduate. And I'm also an executive contributor to Brains magazine. I have taught residents for about 7 years at UNLV Family Medicine program, their training program, and I've mentored them as assistant professor. And I have also lectured to other healthcare professionals on palliative care specialty topics, among other things for Project ECHO. Nowadays, I focus on empowering patients through harnessing their thought leadership for their own health, specifically for reversing prediabetes and chronic disease prevention through my company, Vivo. All right.
Yes, thank you. That was wonderful. Hi, everyone. My name is Hiba Al-Khatib. I am a Master's of Public Health. I did my undergrad at UC Berkeley and my Master's of Public Health also at UC Berkeley. I'm the founder of Palestinian Public Health, and a lot of my work is centered around health equity, but not just health equity, health justice. I believe that we do need a just system, and we do need to tackle the systemic inequities and barriers in order to achieve health equity. So I do a lot of speaking and webinars and advocacy around health initiatives for diverse communities and a lot of different collaborations and work, community-based work and research. So happy to be here.
Wonderful. Thank you, Hiba. You have accomplished so much already, and I'm very impressed with your resume at such a young age, so that is really fantastic. So I wanted to talk a little bit more about empathy and leadership, especially in healthcare, because I think that is a really important topic to discuss and to keep developing in especially today's healthcare system, and especially after we've heard a lot of the grievances and problems that were discussed in the previous chats today and panels. And so as our young doctors and students transition into leadership roles in healthcare, we really have to understand the foundations that are required to help them succeed. And there are 3 pillars that I want to touch on for that, and those are, first of all, meeting the young leader where they are, a topic that we spoke about early this morning, and I think that is really important and ties really well into education as well. The second part is fostering self-awareness, and finally leads into developing a growth mindset so that our young doctors, as they step into the leadership roles, can overcome their limiting beliefs, their biases, and also their perfectionism, which we all struggle with. So let's begin with the first pillar, meeting them where they're at. So when I work with residents and medical students, I do recognize the very impressive paths that they have already traveled to get to that point. And even though they're still early on in their career, they've already shown immense dedication, resilience and tenacity to get to where they are in their career, even though it's still early. And we have to remember that each individual comes with their unique set of views, personalities, experiences, and perspectives. And our first step as a mentor for them is to really listen to them with an open mind and ask really good questions to understand who are they really, where are they coming from, where are they starting. And so as these young docs start moving into leadership roles in healthcare, they will be the ones shaping policies, systems, and innovations in healthcare, something that was touched on earlier as well, and I think that's a really important point to consider, that ties directly into innovating for equity and cultural diversity that is really vital to providing adequate and better care for everyone. And so we as mentors actually act as a coach and take that coaching approach where we show them that way what kind of leader they can grow into and show them what their potential is. And then on the other hand, understanding their aspirational selves as a leader is also key, because in order to know what you're going to be, you need to know where you're going. What kind of leader do they want to become as they grow? Not when they grow up, but as they grow and keep growing. And we have to really help them articulate that vision very clearly, and it provides a good sense of direction for them to move along that path, to become that leader that we need. And so the way we can do that is through open discussion, self-reflection, and sometimes even journaling. Journaling really helps, but that act of self-reflection really also helps them to raise their self-awareness. And self-awareness then leads directly into the next pillar of, building that empathy as they become aware of, this bias that somebody mentioned, one of you, about the COVID patient, the decisions people have to make. There's unconscious biases in there as well, and we find them within our data system sometimes as well. And that makes me think about the Apple Watch that was mentioned earlier too. And I recently read that actually. And I thought, wow, that is wild, but we need to know these things. We have to have accurate data as well, and having that self-awareness for that, and having self-awareness in recognizing your own patterns of perception is really, really important. And so why is empathy so vital, especially in effective leadership, is that it really helps in taking a better perspective and really enabling leaders to see their impact within a larger context. What is their role, not just for themselves, I'm doing this job and I'm just doing it. You have to actually look out and see, how does it affect everyone else? Because my actions will affect everyone within that healthcare system, from patient to administrator, maybe even to the data person who is developing AIs. And so understanding that impact is really key to then also foster supportive and innovative team environments where that kind of thinking can be perpetuated. And then we can hopefully affect a culture change for that as well. And so one way we can do that is then by using mentoring programs, which we have in place in healthcare. We have older docs teaching younger docs, teaching students, teaching younger students. So it just kind of goes like little organ pipes. And as it is used to bring about any kind of positive culture in healthcare, we also have to be careful to recognize and not to perpetuate any kind of old biases and unhelpful behavior patterns, which, anyone who went to medical school and has been through residency and is, working in healthcare, there are a lot of those patterns out there, and I've experienced them for the past 20 years. So there's a lot of work to be done still. So finally, adopting a growth mindset evolves out of all those other those two foundational pillars. And that growth mindset also will help, coming back to the young leaders that we're shaping directly and personally, it kind of help them overcome their fears of failure and imposter syndrome. A lot of us struggle with it. And people talk about it, and you go, my God, I mean, you're so smart. Why do you think what's going on? And it can get them really stuck, and that perfectionism then will in turn also lead to burnout. And we can't afford to have our healthcare leaders burn out. We need them, we need everyone. And like what was mentioned earlier in our first discussion, everyone needs to do a little bit to come together, move in the right direction, and then we can perpetuate that change in a more positive direction. So as mentors, our job then is to recognize all those limiting beliefs that underlie that stuckness, so to speak. And we have to examine it, and to examine such limiting beliefs, you can only really do that if you have a safe environment where you can say, no, every learning opportunity or every stumbling block is a learning opportunity. We're it's psychologically safe to express fears, limits, biases, whatever it is. And then we can work on reframing those perspectives, and out of that say, look, you learned something from it. What can we do to move forward? What can we do to get into the right direction here? So we're coaching them all the time. That's what we should be doing. And it's really, when you boil it down, about developing a lean startup mindset. And I really love the term. I talk about it all the time. My colleagues will probably tell you, yeah, she talks about lean startup a lot. And what it really does is it encourages experimentation, iteration. If something doesn't work this way, sometimes you don't have to try harder, you have to try different. But you have to keep looking, you have to have a 360-degree view and a full perspective, and you have to listen to different perspectives. And you have to make sure that you're not missing perspectives, because sometimes there's people that we forget to ask. But we still have to do that. And this kind of mindset will help us get there. So in the end, if you have a leader like that, it really empowers them then with a skill set to create more patient-centered solutions, and then also shape more meaningful policies. We really need that. We've all, looking at healthcare these days, it's like, yeah, we need something better. We need to move with the times, we need to move forward. And so we have right now this very interconnected landscape in healthcare. Everything is globalized. There's a lot of digital tools out there for patients to get connected. Finding the right tools sometimes can be, oh my gosh, don't even want to get into that. But in order to perceive that whole landscape and boil it down into something meaningful, you need to have a leader who is open-minded and has that polycentric view, and that ability to take a polycentric view, is critically aware of any perception biases, and is then capable of driving those solutions towards better healthcare that streamlines workflows, that serves patients of all cultural backgrounds better, and then also reduces burnout, again, because you make it better, and it's like, oh yeah, actually now we're making an impact, and that's why we're here in healthcare, because we want to make an impact, we want to help people, we want to make a genuine difference. That's why we went into the field in the first place. I did, at least, so. And so that's kind of just to wrap up my initial thoughts on the topic of how we can nurture and raise our upcoming leaders that way. And now I'm going to give the floor to Hiba.
That was wonderful. So many insightful thoughts that we can learn from. My journey with leadership, I think, I kind of touched on this in the previous panel, was, internally, I love to help people. I love to talk to people. But there was also this gap, right? There was this need for representation. And I quickly caught on to that and realized that as young as like middle school, when I would open a textbook and on the map, my country of origin and where I'm from was not there, and my identity was not represented. And so as I got older, and my family had certain struggles, and, I would talk about women's health, and I'd be in these spaces and nobody else was talking about it, or it was not acknowledged. And so when I got to undergrad, being in the healthcare field, this was a big problem, is that, why is one group of women, and this isn't just the case for Palestinian women, it's the case for a lot of marginalized groups, why are they not being talked about? It's this dehumanization, it's this like subcategory, why are we not caring about it, right? So this is a larger problem in the healthcare field that many patients have also experienced. From my experience with working with like physicians or in a healthcare setting, is like they get discouraged from going to a doctor's appointment or being in a healthcare setting because they don't feel seen. They don't feel like their concerns are being addressed. And we've seen a lot of statistics on this with Black mothers and the fertility rates there, right? And the same case for Palestinian mothers due to the occupation dying. So I always say that, at least for my case, a lot of our people are dying not from life-threatening diseases, but from man-made diseases, right? Racism, occupation, systemic inequities, right? So for me, leadership is coming into this space and thinking, how can we, and this directly relates to public health, we really love the upstream approach. How can we dismantle these inequities and barriers from an upstream, right? If we can get rid of the root cause, right, racism, oppression, all of these things, we can make for a really nice flowing stream of healthcare, more equitable access to healthcare. So it's, instead of going to the doctor when your foot, right, you break your foot, for example, you go to the doctor, he fixes your foot, but the doctor didn't ask you what was the reason. The reason was you probably had, or for example, your housing situation is really poor. Your stairs are like broken. So every time you go down the stairs, you fall. So now you come to the doctor again, your foot is broken again, right? So he fixes your foot again. Next week, right? This is like a made-up scenario, but you get the point. It's like he's not fixing the core issue, right? He's doing a very important job, which is fixing the issue you have at that moment, which is we still need that. But the people who are, in the other fields and part of this health field should be thinking, what are the societal issues, right? The systemic issues, right? How can we get him more accessible housing? How can we fix his stairs, right? How can we fix the root issue, which is that his home is not equipped for him to live safely? So my sense of leadership was like, how can I be a leader that is trying to promote equitable access to resources? And so I created my organization, Palestinian Public Health, for this safe space. It started, with students who did not feel seen, and it was this diverse community of students from all over who had one cause, which is to raise awareness to health inequities from silenced voices, right, locally. So this was in the Bay Area. We have a lot of communities locally who need to be amplified. Their voices need to be amplified. A lot of systemic issues, housing is a huge crisis across the nation. And all the way globally, right, to places like Palestine, where there's occupation, there's oppression, there's checkpoints, there's barriers, right? And none of these issues are far removed from us, right? I said it on the other panel that I, just by chance, happened to be born here. I could have been born where my family was born, and I wouldn't have had all the opportunities I have. So it's really taking away this mindset of like, oh, this could never happen to me, and being like, oh, all of us are just one paycheck away from being houseless, right? And, on the line of mentorship as well and being a leader, when I think about the most impactful mentors for me, I mentioned my mother previously and her words of wisdom and inspiration, and just sometimes her not saying anything but just being there as a sort of support system. And then I also think about like my favorite professor from college and why she was such a great mentor for me. It wasn't because she told me, oh, apply to grad school, or oh, apply for this job. It actually was never like that. It was because she was compassionate and she uplifted me. So she uplifted what I believed was right and the change that I wanted to make in this world. So, and it was another key point on mentorship is, which relates to public health as well, our beliefs in public health, is that it should be a sustainable relationship, right? Anything long-term sustainable is going to have a longer impact down the road. So even after she was my professor, she still would check in on me. And something that I'll never forget is when my house, during my master's program lit on fire and we lost, we were displaced from our home because of the fire. She had texted me that night, and because we had a meeting, right, just like a check-in, a mentor check-in, and she had texted me, oh, do you want to come sleep in my home? And I was like, oh my God, like that just shows that, it's such a, like that compassion, that care for you as an individual goes such a long way. And I think that we should be working to build relationships like that within the field, within our education system. And this really goes for, I like how physicians deal with their patients, right? The same way that we have a screening for depression, we should have a screening for systemic issues, right? Societal issues, barriers that your patient is facing. And something that I'm currently working in is on medical legal partnerships. And something that we see, basically this project initiative, is it merges the health field and the legal field. Something that most people, or maybe some people, don't think about is, they're just stuck in their own field, but they don't realize that they are intersected, right? All our fields are intersected. And something we see, because we specifically work for Housing for Health, is that there will be patients who will tell you they do not go to their checkup appointments because they are afraid that they will be evicted from their homes while they are getting checked up. So they can die from not going to get their checkup, whether it be a screening for cancer or a screening for diabetes or a mental health check-in, because they are afraid of losing their home. So that is a systemic issue, right? Nobody should be in such fear of losing their home to the point where they're not going to their doctor, right? And then the same thing when they go to their checkup appointment, there should be a care, right? And this is something that is deeper than just, saying there should be a care, right? There's time constraints for physicians. A lot of them are overworked. There's a lot of issues that we need to tackle, but there should be a care with, what's happening outside of this office. Why did you not make your appointment? And then there's transportation, right? When I got in an accident and my car got totaled, there were a lot of times when I couldn't make my appointment because I no longer have a form of transportation. So that's the case for a lot of people who don't have a form of transportation. And the same thing I worked a lot with like food equity. Why are certain backgrounds healthier than others? Is it because they like junk food or there's cultural, foods that they love? Maybe. We all love our junk food and, cultural food. But to a certain extent, that's usually not the sole reason, right? It may be because they live in a food desert where there is not a grocery store right next to them that they can conveniently get to, right? They don't have a car, gas is too much. And then if there is a grocery store, it might be like a gas station where there is not, a plethora of foods and healthy options. And then the prices, right? So now you have like a financial issue, you have a transportation issue, you have a home issue, you're probably taking care of multiple kids. Maybe you are the kid who's the provider, right? And then that merges into like the education system. Why is this kid not performing well in school? Is he a bad kid, or does he have things going on in home that is not allowing him to show up as his full version of himself? Which relates back to how can we be better mentors and leaders that are uplifting kids from a young age, which is our discussion today, which is nurturing these seeds, right? How can we nurture these kids to believe in like humanity, that, we care about them past just the grade on the assignment, right? Because one kid might be getting a really good grade because he can fully just focus on school, versus the other kid is taking care of his family, working, maybe has a chronic disease that you do not know about, right? Because people are not telling you everything they're going through, right? And I saw firsthand with losing our home, my health definitely deteriorated, right? The home is the center of your health. If you do not have a safe place to make food, to sleep, right? Sleep is so important. To feel like calm, that is going to make your mental health and your physical health deteriorate, and you're not going to have as much energy, right, to show up as your full self. So I think there's a lot of topics within the health field that we can improve on. I think public health has a lot of frameworks that we should be pulling from for local and global issues that we can learn from, and there's a lot of opportunity to be better mentors and leaders, to nurture seeds, right, which is our like future generations, our children, right, our siblings who are smaller, to plant that seed of like hope and that you can make an impact and that you should care about other people past just what you see from the outside, but thinking deeper as like, what is the root issue that is causing this chronic disease, right? Why do they have diabetes? It's, right, diabetes, you need, I mean, you will know this much better than me, right? You need a whole holistic plan, right? You need to exercise, you need to eat well, you need to rest. You can't just give them medication and be like, here, right? That's like not gonna cut it. So there's, yeah, a lot of thoughts, but hopefully that.
Well, Hiba, thank you so much. It was very insightful, very informative, and I think you brought up a lot of really good points. And the last part that you mentioned really makes me think about patients come to the doctor, there's not enough time because the doctors are overworked, they're burnt out, a lot of us still reeling from COVID and haven't recovered. Where there's something even called empathy fatigue that actually has rolled through the provider system. And that's pretty disastrous because it works against what we're trying to do, trying to move the needle towards a more holistic approach to health. And that's, a lot of the points that you brought up work into that, where you need to really have a system that makes it easy to get that information quickly, so you don't have time to talk to a patient for an hour every day. You'll never get a doctor's appointment ever again. So there has to be a solution that brings that picture into a holistic team of providers, doctors, nurses, social workers, spiritual workers, counselors, and have the patients, of course, at the center of that. And where you then can go and say, hey, this person, oh my God, they're just non-compliant. They just get labeled. They're non-compliant, not taking their medications. Well, why not? Because they're facing things that you were mentioning, and that is very, very common. I see it every day when I admit patients to the hospital. They don't understand why they're taking it. Nobody's explained it in the words they can understand. There's cultural issues where it's like, well, your pain tolerance, but you're okay, you don't need pain medicines. Oh my God. And then looking at, there's depression going on, there's grief going on, there's loss going on, there's food insecurity. Some people are dealing even with a great deal of spiritual pain for whatever it is they're going through, and that often remains unaddressed. And having a leader who then has that, as you mentioned, has that curiosity to learn more and to say, I'm willing to really just ask a few questions and get to know these people and see what can we do. And maybe not every provider can say, I'm going to go out there and go shop for them or drive them around, but you can move that first domino at least. You can say, I can take a little bit of extra time, a little bit of extra effort, a little bit of, care and curiosity, and say, what's going on? How can we help? So then when it comes to designing any solutions, all of that needs to flow into that as well. So Hiba, what I wanted to ask you is, what do you think, what are some qualities of an impactful leader, especially in the context of everything that we've discussed so far?
Yeah, those were some great points. For me, an impactful leader, I've touched on this a little bit, is someone who isn't merely giving instructions, but is helping others feel empowered, right? So in terms of specifically the patient journey, right? It's how the patient can be an advocate for themselves, right? They can feel empowered to ask questions. Like you mentioned, that is so incredibly true that a lot of times you go in for your checkup appointment, it's very short, right? The provider has a list of other patients, and I've seen this firsthand working in the hospital with physicians, shadowing the physicians. They will go through the patients, and they're on a time crunch. So they will just tell them, oh, okay, like this, that, here, take this. And if you don't, right, you should ask questions, right? And sometimes as a leader, it can go a long way to tell your mentee or, who you're talking to, like, hey, maybe ask a question next time, right? So I think impactful leader is somebody who guides somebody, but at the same time, they're empowering them to use their own agency. So it's a sustainable relationship where you're growing with them, right? And it's not somebody, as a leader, you shouldn't feel like, oh, you know everything, because you don't, right? You should ask questions. You should learn. A lot of times you can learn from the person that you're mentoring, right? And then this leader is also somebody who really wants to make an impact and a change that isn't just helping themselves, right? And we see globally there's a lot of leaders who are selfish. They think about themselves. There's a lot of capitalism. There's a lot of monetary gain, right? Colonialism, where they're not thinking about the way that this impacts people for generations, right? Your impact, if you are put in a position of power, that is a great responsibility. Like, your impact, what you do during your time as a leader, doesn't just impact the current people who are alive, but it impacts the people after them. It impacts the way that those people raise the people after them, impacts the opportunities that other people have. So it's somebody that really wants to create this positive change that will hopefully last for, right, it will carry on. Like, their legacy will carry on and people will reference it back. And Malcolm X has, he did the speech where he talked about how young people need to think for themselves, they need to see for themselves, and they need to listen to themselves. So he was really emphasizing that don't just listen to what leaders have to say or what people have to say, but use your own agency to think. Like, somebody tells you something, think, does this make sense? You hear something in the news, does this make sense? Like, does this have evidence? And when you look it up or you write, that's not even enough. There's a lot of ways to fabricate things. So it's really you using your own agency to not just listen to everything you hear, but think, what is the impact that I want to make, and how can I make a difference? And another really, like, something that I really think about recently, I'm sure you're all aware that there's been a genocide in Gaza for the past 8+ months, and we've lost countless physicians, countless healthcare providers. Our hospitals have been bombed. Things that we take for granted here are non-existent there, right? There's no food. There's a famine. You're right, a man-made famine. There are our hospitals that we value so much are bombed. Our physicians that we value so much have been murdered. And there was a Palestinian nephrologist, Hammam al-Loh, who stayed in a Shifa hospital providing, and one of his last interviews before he was murdered, they asked him, which I recommend that you all go and watch, it's on Democracy Now!, they asked him, why did you not evacuate, right? Why did you not leave the hospitals so that you could, try to survive? Because it's very dangerous, right, providing and honestly existing anywhere within. And he said, I did not go to medical school and study for 14 years just to think about myself and not to think about my patients' lives. So that, to me, is an impactful leader. That is how our mindset and mentality should be, that our actions are to inspire and help and uplift and save other people. Like, we do not go to school, we do not become successful simply for ourselves, our own accolades, money, things like that. That is monetary happiness, that is momentary happiness. That is not fulfillment, and that doesn't leave a positive change. So I always reflect on his words. I think I reflect on his legacy, and the fact that his legacy persists till now through voices like mine who remember him, who remember physicians like him, who carry on. So his death was not in vain, right? There are people talking about him. There are people who remember what he did, and the stance that he took, and the fact that he thought about his patients' lives just as valuable as his own. So that is, the health care provider that I would hope to be, the public health leader that I hope to be, is that it's someone you can come to that you can really rely on, that they're there for you. They
Absolutely.
want to help you.
Yeah. Thank you so much. Wow, what a wonderful insight. And so we've discussed so many really good points today in this panel discussion, even though it's small. I think it's been very powerful. I want to hear what are your thoughts, what are your questions on that topic of what we can do to raise impactful leaders and nurture them.
I was going to go grab. I'm curious, Dr. Cadwell, about two things. In my work in healthcare systems in the U.S. primarily, there is an ongoing conversation about how to make the transition from illness-based education for docs to what it is to think about lifelong health. Mm-hmm. So one angle is social determinants of health and getting healthcare systems more integrated into communities to understand all of the dynamics that Hiba and you have both talked about. But there is a great deal of resistance on the part of the docs who are highly rewarded and regarded for their deep expertise, not so much rewarded for their humanity. So that's one question. Yes, I understand empathy, but to make this bridge from illness-based to health-based, it's going to require that they get rewarded a little differently. So that's part one of my question. And part two, a little story. One of the docs as cardiologist that I was doing some coaching work with, he and his emergency room team. And he came into the office one day after we'd been working together maybe 3 months. And everybody was in a tizzy because this patient would not agree to the next piece of surgery, and without it, he was going to die. And they're all looking at the doc saying, can you fix this problem? And he remembered something that we'd been talking about. And he got everybody out of the room, and he sat down on the end of the bed, and he looked at the gentleman, and he said, what are you worried about? And the guy got a tear in his eye, and he stayed really quiet. The doc stayed quiet, and he finally said, my wife is home alone, and she doesn't know how to go to the grocery store and get food. I have to go home. And he called in his nurse and sent her to go get groceries and deliver them, and had the phone dialed so the wife could speak to the husband and assure him that he was okay, that she was okay. He had the surgery, he survived. That's the moral to the story. But the point is that this was a doc, highly regarded, captain of a ship in his emergency room, very sought after cardiologist. That isn't what won the day. How do we help hospital systems create rewards for that?
I love your question because I've had similar situations, and I have also, as a palliative care provider and specialist, those are points that are actually, they're part of our palliative care work, actually. And so let me briefly answer the first part of your questions, where we get into value-based care, which actually is being promoted and pushed forward currently by CMS and Medicare, because there's this realization that our healthcare system cannot function on a fee-for-service basis for much longer. It'll bankrupt, it's expensive, patients are suffering, and there's a lot of cost, not just monetary cost, but cost of human life and suffering, and not just life in the term of life and death, but life with no quality burden in the system. And in order to correct that, which will take a long time probably, but in order to correct that, CMS is bringing in this idea of value-based care, which addresses exactly that. How do physicians and providers get rewarded? How do health systems get rewarded for keeping people healthy? And so when it gets into value-based care, it takes a lot of principles from palliative care, which is, for those who are not familiar with palliative care typically works together with hospice, end-of-life care, but palliative care is not end-of-life care. It is care for symptom management, pain control, chronic disease management, and quality of life focused, and takes a holistic approach that goes all the way from physical to spiritual care. So with that huge tool set and skill set that palliative care has, it moves it into other parts of healthcare that are outside of palliative care, so outside of patients that, let's say, are suffering from cancer, undergoing chemotherapy, or said, I don't want to get chemotherapy anymore, but I have this chronic pain, I need to have it addressed. And it moves it towards preventive care, where the focus is with that holistic approach to say, over here, the patient is still okay. They have some risk factors, they have heart failure, stage A, they're at risk, they don't have it yet. How do we keep it from happening? They're pre-diabetic. How do we keep it from happening, moving down the line with diabetes, losing kidneys, eyes, and whatnot, and what have you, and all those other horrible things that go with it. So there's reimbursement for that, and the difficulty with value-based care is to really capture that quality model, the quality measures and the management. And there are several healthcare startups in the US that are working on that and that are building and have built and continue to do so and grow healthcare models based off of that. And your second part of your question, how do we instill that empathy and that caring and that active listening into our doctors? And I think that that harkens back to when we talked earlier about how early do we start? Where do we coach them? Because we have to coach them. We have to actively demonstrate. We have to show this is the kind of leader we want. This is how you want to act. I've had a very similar conversation with a patient not too long ago. Didn't want to be intubated. I said, or the nurses came to me all in a tizzy. We have to do something. You have to drug him. We have to do the blah, blah, blah. He's going to die. And I thought, that's all true. But let me talk to him first. So he didn't know he was going to be in a medically induced coma. He thought he was going to be awake with a tube stuck down his throat. And he thought, well, I'll be gagging all the time. So, and it took 5 minutes to get that answer. So everyone who already does that needs to continue to demonstrate that behavior with others, not just patients, but with all team members of a healthcare team. But it's a culture change, I think, that when we start teaching medical students still, and I talked about this with the mentoring programs that we have in place, a lot of times still we perpetuate those old ideas. And I cringe when I see those things happening, and I go, oh my God, let's talk over here. But I find that when you have that open dialogue, you have that open discussion, and that's a skill set to develop as well. You have that open dialogue with your students, you will find that they actually open up and say, oh yeah, that makes a lot of sense. And then demonstrate that actually you save a lot more time by doing that. Because otherwise you're going to end up in a power struggle with a patient who says, no, I don't want to have the surgery. I mean, you've probably seen how that can go. There's a lot of butting heads and yelling, screaming, and arguing instead of just sitting down and a few minutes later you have your answer and your understanding. And it takes so little to intervene sometimes. Not always, but sometimes that's all it takes. And it takes just so few, it takes so little time to just ask that question. So I think maybe introducing a coaching skill set into the medical school curriculum is very helpful. And as a coach myself, once I became a certified coach, I thought, gee, why don't we all do this? Everybody needs a coach. Everybody should get coached. Everybody should coach someone else because, thank you, because that coaching relationship is the container for that coming together and that understanding. Because those skills, those are basic skills of human interaction. And I think those are basic skills too that overcome those, those human basic brain programming that we understand of, there's us and them, and that's group thinking that behavioral science is looking at, and research. I'm not going to get into that, but there are ways to overcome that. And
Thank you so much.
one way
I'm
to
so
do
sorry to interrupt, but we are over
Thank you so
time.
much. I
Let's
get
give our
very
panelists a round of
passionate.
applause, please.